What I love about family medicine, probably mostly the relationships you build with your patients. That you don't, especially in a small town, you get to know your patients. They're almost, a lot of our patients are my friends.
What I love about family medicine is really being able to see all spectrum of patients, the old, the very young, pregnant women, and the families. I really enjoy working with and among families. Most of the time I'll see one of the family members, then they'll send their significant other or they'll bring their children to me, and it's just really neat to get to see the family interaction.
Frequently you have a better understanding about that patient because you know grandma, you know mom, you take care of the uncle, you take care of the cousins, so you kind of have a big snapshot of the whole family, and it really does make it easier.
When you get to know an entire family, you have a unique opportunity to make a big change because you get to affect all the units. It's not just the child that you're treating, you get to treat the child and the parent.
I love the diversity. Even when I was doing urgent care for a very brief point, I was never bored because there's always excitement in every case.
Family medicine is for somebody who loved all their rotations.
The student who finds themselves on cardiology wondering about the patient's diabetes or about some other aspect of their care, and finding themselves able to go back and forth.
I love that sort of every day you're seeing something different.
You get to do everything. If you liked psychiatry, great, you're going to get plenty of psychiatry. If you liked taking care of kids, we see kids. If you liked GYN, if you liked obstetrics, you can still experience all those same things on a daily basis.
I mean, you can't beat family medicine for a small town. I mean, because again, you're very well trained, diversely, to manage what comes in your office. But you also, I think, where other specialties you see not get that training in community education. I know part of my residency program was community education.
A lot of people think that you're only involved in serving a community if you're in a rural area where it's a small town. But I've practiced my entire career in a suburb of Columbus, Ohio. So even in the big city, I've found those small little community settings to be very important and have been very involved in my community.
An adaptable generalist can more carefully fit their practice to the community's need. So for example, when I went to Bellefontaine for practice initially, there was no psychiatrist available. And so I had a special interest in that, and I became the psychiatrist in those early years for our group practice.
For procedures in family medicine, you can just about do anything you want, short of taking out somebody's gallbladder. And I've even seen some family physicians who do that, actually, depending on where they are practicing.
Normal lump bump dermatologic kind of procedures are very common for most of us. I also do vasectomies, and that's something that seemed to be a natural progression with doing obstetrics. So as a couple was completing their childbearing years, I was able to offer that as a service and continue to do that.
Colposcopies and LEEPs and endometrial biopsies and breast biopsies.
Doing any kind of gynecological procedures such as placing an IUD, doing the Nexplanon for contraception, procedural skills in obstetrics.
I do upper and lower endoscopy, colonoscopies, EGDs.
I don't do C-sections, but as a family practice doctor, you can go on to do C-sections if you want to.
If you ask what one thing I love about family medicine, it's the fact that you can do lots of different things. And that can change over a life cycle or over your career. You know, I've been in solo practice, I've been in a group practice, I now teach in a residency program. I've done political advocacy and worked with policy making.
I've got, colleagues in family medicine that are doing all kinds of things. Urgent care, behavioral health. One of my mentors is now the medical director of a lipid clinic. I have another colleague who works closely with cardiologists doing stress tests and preventive cardiology.
I have several of my colleagues, and I tell them, I work for a cruise line and I'm a cruise physician. Oh, I can do that. I'd love to do that. I'm like, you can't. They'll only hire, family physicians or trauma physicians or ER doctors. So again, being a family physician gives you lots of opportunities.
Medicine will change with you. You are not going to be the same doctor when you get closer to the end of your career than you were at the beginning of it. So there will be change, and that is the one constant in medicine, like it is in a lot of things. Things are always changing.
One of the things I think is interesting about most of the fellowships in family medicine is that they are really based on sort of populations of patients. It's not like a disease specific, like going into neurology or GI, you're really focused on a body part. But I think in family medicine, it's often like, I do addiction medicine, which I guess is a disease, but it's also like a population of patients, or geriatrics, or doing women's health. So I think it's sort of different in the way that we kind of just go into a specialty in general.
So when I first started medical school, I was absolutely sure I was going to be an OBGYN because I thought delivering babies was the best thing ever. But then I had the opportunity to work with a family physician in a rural community who did everything except obstetrics. He took care of families over generations, and I really loved what he did and the connection he had with all of his patients. I then had the opportunity to meet a family physician who did OB, and when she told us about what her experience was like, I thought, that's really me. That's what I want to do.
If someone's looking for a career in primary care or being at the forefront of somebody's care, you have to be able to be comfortable with a pregnant mom. You just don't know what's going to walk through your door. You're a primary care physician, you need to be able to be ready for that.
Part of the whole family medicine philosophy is to provide obstetrical care for our patients because we're providing all the other care for our patients. We're trying to serve our community, and if our community needs people with obstetrical skills, we're right there to provide that.
I care for pregnant women with substance use disorders, primarily opiate dependence, because that's a big problem here in Ohio and across the country. I take care of them during their pregnancy, and then I or our team will deliver them, and then I take care of them and their babies for up to a year after they deliver. So I do think family medicine puts me in a great place to kind of do all those things. I think people tend to look at these women from lots of different perspectives, so like the OB perspective or the infant in particular, and as a family doc I can kind of see all of those things.
Over the years now I've had the opportunity to deliver babies and take care of them throughout their entire life, watch them grow up and have babies of their own. So I'm kind of a grand doctor, delivering babies of babies I delivered.
My own daughter went to an emergency room in Chicago and ended up with a $10,000 bill because she fainted at work. If she had gone to a family physician who knew her and who took a more generalist approach to making a diagnosis and living with a little uncertainty, knowing that you were going to continue to see that person, you didn't have to have all the answers right that minute, she might have gotten out of there with a $100 bill. That's how we're going to make a difference.
Well, I think the big thing right now is going from the sort of fee for service to payment for care and quality and kind of keeping people healthy, and that's like our realm. That's where we live as family doctors, is at keeping people healthy. So I think as the healthcare changes out of necessity because of how much it costs our country, I think there's going to be an emphasis on primary care where we're going to need more primary care docs to give that care.
Anywhere you go, they need family doctors. There's just not enough family doctors out there, and so anybody going into a career of family medicine will have opportunity to pretty much work wherever they want, as well as getting opportunities for loan repayments.
There is always going to be a need for primary care. We are not going to be replaced by computers or by nurse practitioners. We will learn how to adapt and utilize those and integrate that into our practice.
But if your heart lies in family medicine, don't let all those economic factors and other people telling you that you should or shouldn't do this make your decision for you. Follow your passion and do what you love, and you'll love going to work every day.
Consider it. Don't immediately dismiss it. Many students start medical school thinking they want to be a primary care physician, that they want to be a family physician even. And what happens through the course of medical school is that those fall off. And so I'd like to see it actually grow so that someone who started out medical school thinking they wanted to be a specialist suddenly becomes intrigued with generalism and decides that, you know what, I'd really rather be a comprehensive primary care physician.
I still, after all these years, I still come to work. I'm happy to come to work every day. I'm excited. I'm excited about the projects that I get to do. And I'm excited to care for patients every single day. That part never went away.